Hi, everyone. This is another one of MCAEL's series of MCAEL Connects with different people in our community. Again, I'm Kathy Stevens, the Executive Director of MCAEL, and I'm joined today by our good friend, County Councilmember Craig Rice. Hey, Craig.
Hi, Kathy. How are you? It's good to see you.
Good to see you too. Thanks for being here all the way from your wonderful Up County district. We appreciate it.
Absolutely.
The beauty of Zoom, right? Neither of us had to go on 270.
There it is. That's right. That's right.
Yeah.
It was a blessing today for sure.
Today, yes. Although it's beautiful out, I wouldn't mind
Yeah,
riding around with my windows down personally.
right.
But yeah, there's work to be done. So, Craig, thanks so much for taking the time to be here. You have been a champion of education in the county. Obviously, you chair the Education and Culture Committee, committee to which MCAEL provides our series of reports on an annual basis, biannual basis, I guess. Is that twice yearly, biannual? Anyway, and know a lot about the work that we do. And I hope today we can just have a conversation about some things that you're looking at from the council perspective, any initiatives you want to share. I'd like to cover some things around the digital divide, talk a little bit about vaccine and how language ability really has played a role in our public health right now, and what we can do to make sure that our communities, our immigrant communities, communities of color, that we're seeing this all with an equity lens as we do all our work. And we'll have a free ranging conversation. So I'm sure we'll cover about 100 different things during our short time together. So do you want to just start by giving us a quick overview of some things that you're looking at from your office right now that might tie in with our work?
Sure. So I think that overall, the topics that you have presented are certainly ones that are in the forefront of everyone's minds, and they all kind of go together with COVID recovery. So recovery happens in a number of ways. Recovery from a health perspective, in terms of ensuring that we continue to test as well as vaccinate now that we have vaccines, but also COVID recovery when it comes to economic recovery. So workforce development and ensuring people can return back to work. People can find new jobs because some of those jobs that they may have had a year ago no longer exist. And so from that perspective, we really need to help to make sure that we retool them for the jobs of the future. And then when it comes to overall education, making sure that we can continue to support our parents who are supporting our students, many who are challenged with distance learning and experiencing many of the differences in which having that in-person classroom instruction is versus having this virtual learning model that relies heavily on our parents to be a resource to our students. And so from that perspective, there's a lot of things that are going on for us. We really are focusing as a council on the COVID recovery. You'll see a budget, I think, that reflects just that. We've seen it over the year as we tried to respond to this global pandemic, to the racial unrest, to the myriad of challenges that we saw in our community by making sure that we put our money where our mouth is. We stood up resources to help many of our restaurants and their restaurant workers, primarily who are people of color, many of whom are immigrants and speak English as a second language. We know all of this. And so we wanted to make sure that we gave the resources necessary. We wanted to make sure that when it came to keeping people in their homes, giving them financial assistance when it came to home stabilization, and rental assistance, those were things that we needed to do as well. And of course, food insecurity, something that, of course, many people throughout our community are experiencing and affect our communities of color and of lower socioeconomic status. And so we see that across the board. And so the council remains committed to keeping these programs, although we still have started, and I want to emphasize, have started to vaccinate our population. The reality is we still have a long way to go, and an even longer way to go when it comes to coming out of the economic recession we find ourselves in. You don't hear a lot of people saying that word, but the reality is that we're in one. And so how do we help our folks to navigate that is incredibly important. And so we know that our immigrant community, many of whom speak English as a second language, certainly are a key contingent for us in getting folks back to work to make sure that our economy gets back on track. So.
Yeah, so true. All of that. Thank you for sharing all of that. Let's dig a little deeper on the digital divide issues, if we might, because I know you've been working a lot on these. And let me just share, if I can, a few things that we're hearing from our constituents and a few things that we are putting in place and are working on right now. I feel like in some ways we're a little late to the game, but the information keeps evolving in terms of what we're hearing from our folks. So most all of our classes made the switch to virtual learning back in late March or early April, and did a phenomenal job with it. And in our role as a coordinator, as the coalition kind of coordinator, we have provided really a lot of in-depth training on how to teach online, how to make classes more interactive, all that kind of thing. Just really, and I have to give kudos to all of the programs out there and all of their instructors. It's, some instructors, they weren't so sure they could do it or wanted to do it. It's a whole different medium, but they've done it, and they've done it well and continue to be invested. The challenge that we are hearing, even I had a conversation yesterday, is there's still many families that do not have reliable internet access in their home. And we know this, we know the county data, and it doesn't support, say, all the members of the family. And so there's that issue. There's the connectivity, reliable, affordable internet access. And there's the actual device issue. Do you have a computer? And so let me start with the reliability. I see it now that internet is a key utility. Just as you have electricity, gas, water in your house, you've got to have Wi-Fi to do all the things that we know we're all doing at home. And then in terms of devices, I can remember a couple of years ago when MCAEL first said, oh, it's great, we can have apps for students on their phones, they can learn on their phones. Most students who seek MCAEL services have smartphones. But the fact is they're yes, but they are not sufficient to maximize the learning opportunities that we can present. So we've trained an instructor with wonderful tools on how to do a great Zoom class, assuming someone has a computer, but when they're on their phone, it just all falls apart. Assuming they can stay in class, I just heard a story yesterday about many students who are dropping out as the month goes on because they've used up their minutes on their phone plan. They can't stay in class. So that's just, that's not sustainable. So MCAEL is doing a couple things. One is we're partnering with Comcast to bring Internet Essentials. We will provide some of the financing for that to as many program participants as we can. We'll probably start in sort of 3-month increments. Thanks to Josh Bokey and his team at Comcast, we are going to put that in place as we can for the Wi-Fi. And we're working on solutions to get some additional Chromebooks, laptops, whatever we can. We'll look at refurbished, we'll look to computer manufacturers, we'll look to Amazon, whatever we can do to do that. So I wanted to let you know, what the challenge is and what we're doing, and ask you, are there any other opportunities that you see for us to partner with local businesses, county government, whoever it might be, on these issues, to solve these issues? Because you got to have Wi-Fi and a computer to do your work, your health, your kids' school, all of that stuff.
So I think, fortunately, help is on the way. And I'll start with that. This is a priority that's gone all the way up to the National Association of Counties. And I'm actually wearing my MACO pin today, as I represent the county with our National Association of Counties conference. I'm actually heading up a broadband task force. Myself and JD Clark from Texas are the two chairs of this task force. And it is assigned the duty of coming up with a robust plan in which localities throughout the United States of America can help to increase broadband access for everyone. And that equates to what you just talked about: affordability, accessibility, and high quality. So all of those things go into what it is that we want to see have happen. I will tell you the really good news. About a little over a week ago, we had a meeting with Congressman Jim Clyburn, who has been leading this effort at the national level and has a bill in Congress right now to appropriate huge amounts of money, hundreds of billions of dollars, right, to address this issue. I will say this, after our meeting, the congressman committed to us that he would incorporate our changes and recommendations from the broadband task force into his bill.
Wow.
And we know about the great relationship between Congressman Clyburn and the president. And so I anticipate that he will have a presidential seal of approval in terms of him putting forth this initiative. We also met with Senator Ed Markey on the Senate side, who is the author of the federal E-rate program that is designed to make sure that we have additional funding. And so we've been doing our part in terms of really pushing this at the national level where it's appropriate, because at the end of the day, it's exactly what you said. We have to treat broadband as a necessary utility, just as we do with water and gas and road infrastructure. It's a necessity. And there's no question that whether it's from an economic standpoint for the small business owner who wants to set up an e-commerce shop out of their home, to the parents who need to ensure that they can have their multiple children be online all at the same time doing Zoom, to make sure that the mother or father who may be working from home, and let's not pretend that folks weren't working at home before. There were plenty of people who were working from home before COVID. And so we need to make sure that the system is set up to support them. And so we see all of these things that we started to do some work on because we knew that it was important. COVID made us realize that it was essential. And so that's where we've gone. We've gone from important to essential. And so now that everybody's on board and understanding that this needs to happen, we can look forward to something very robust coming from the federal government, going through our states to our local jurisdictions to help to make this happen. And that would encompass everything, as you said, from acquisition of the actual devices themselves to the signal connection, to the types of affordable programs that folks could sign up for. We appreciate what Comcast has done, but we need folks to do more, right? And so we want higher speeds at that same level of pricing to allow for families to be able to all get online, not just one. Because the reality is it's not just one person in the household who's utilizing that signal. So there's a lot of work that we're still looking for to be done. As a matter of fact, as we speak right now, there's a digital divide seminar that's going on within NACO. So it's actually right over there in my other computer.
And you're at a computer in the other room, right?
So you know, now is the time where we do double tasking, right? And so we have all these things happening all at the same time that we never were able to do without Zoom, right? And so this gives us the ability to push ourselves beyond, but certainly one in which, Kathy, quite honestly, for the folks that you represent and work with, we know how incredibly important this is, because for them to remain connected to the essential skills that are necessary to be employed here, the essential skills that are necessary to make sure that you can be an engaged parent and understand what's going on, the essential skills that will allow for you to make sure that you can manage your health and know what's going on in the community and what's being offered to you. All of those things are essential as well. And so we need to continue to stand that up in the temporary standpoint as a locality, and then as a much larger standpoint from the federal government and state government coming down to the locals.
Absolutely. And I feel sometimes like we're piecemealing it a little bit right now, but I'm so glad to hear about the attention and the legislation that will come from the federal level, because that is clearly what's needed. And, part of that, which I'm reminded of, is that we are also doing the digital literacy training as part of our classes as well. There's so much to learn about, accessing certain sites and dealing with that kind of thing. So that's an important role that we are playing. I will say it's been interesting. We have had, we're tracking our numbers. Numbers have been different this year than they were in the past. We know that some new learners have been able to access classes because it is online. So I would say we've heard from many young parents, particularly mothers, I don't have to leave the house. I don't have to take my baby on the bus, even to one of our classes where we provide childcare during the class. They can be right there. The baby's sleeping in the other room, whatever. So there is a, I don't know whether to call it a silver lining, but something to pay attention to for us in terms of how we package classes and the range of things that we provide. Are there some hybrid classes where you come and you meet week one, you meet your teacher, you get everybody in person, you do your assessments. For the next 4 weeks, you have classes online, and then you have another midterm meeting, if you will, in person. Whether there's some classes that are all on the Zoom. I think there are just a lot of opportunities to think about, and particularly, I'm part of MMF and working on our early care and education system, but particularly when I think about parents who are bettering themselves through their English education, need someone to take care of their kids. Well, if we can give them a class that's good experience on their computer, we want to do that, because that's going to benefit everybody in the long run, of course. So,
and that, of course, is the long term, right? That is the long term effect of what this COVID pandemic has done to us, right? It's made us realize that some of these things are actually things we probably need to stick with.
yeah.
It's very interesting that a child who is sick with some kind of major illness can now be connected with their classroom and not fall behind in terms of their work. We've set up a structure to make that so that it can happen in the future. That's a big deal.
Yeah.
And you said it. It's that understanding that in this county, it's a relatively small county in the sense of area, but the reality is that it still takes people a long time to get around it with mass transit. And we know that a lot of folks rely upon mass transit that unfortunately doesn't get them to places quickly. And so how much more effective is it, right, to not spend an hour and a half riding multiple buses to and from a class when you can actually log on from the convenience of your home, care for your child, right? Not have to find a sitter or find some sort of childcare and be able to attend those classes. It's a game changer all across the board on so many levels. So,
Right. So let's just touch on the state of testing and vaccinations just quickly. Obviously, the population of learners that we serve are students who are of color, our students who live in different lower socioeconomic settings have been hit the most. Their jobs, their health, all of that. MCAEL participates with the Office of Community Partnerships on their committee. I can't remember, it's a 3C committee right now, COVID something, communication. Diane Vu would have my head since I don't know that off the top of my head right now, but we are working alongside many other nonprofits and organizations to make sure we get the word out. Are there just a couple main messages that you would give to our programs, our providers that would say, I'm not going to put you on the spot and ask you when I can get a vaccine, but what should we be telling folks? What are our main messages?
So first, let me give a shout out to Councilmember Navarro and Councilmember Albornoz, who really pushed for a lot of the information that we had to be translated into Spanish from the very beginning, and to other languages, quite honestly. And then for Diane Vu and her team, who really worked well in the census to be able to put forth that same sort of information, get into the communities and make sure that folks knew about testing. And so they did a phenomenal job with that. Now we're taking that and translating that into vaccinations as well. And so our challenge is that, what I've said that concerns me, and some of my colleagues have spoken about this as well, is that with not having the availability of the vaccine, but still telling people they need to get it, makes people frustrated. It makes people want to just say, you know what, I give up. I'm not going to even be bothered with it. And so there's so much talk around hesitancy all the time. And the reality is that let's address hesitancy when we need to, and we can have a robust plan for how to deal with that. But right now, we've got so many people whose sleeves are rolled up, ready to go, that we are not able to get to because we don't have enough vaccines. And so my message to folks is that help is on the way. Johnson & Johnson with their vaccine has made it a lot easier for us, especially since it's only one shot, to be able to make that happen. And so my first message is to make sure that folks know that all of these vaccines are safe. Yeah. We've seen very, very little in terms of some side effects that were serious, and any kind of life-threatening conditions as a result of the vaccine. Very, very few. And you're talking about millions and millions of vaccines disseminated and a handful of serious cases of something happening that related to a lot of other things with folks' health. And so again, the vaccine is safe. Please take it as soon as you're eligible. It is incredibly important. The other thing is to make sure when it's your time to pre-register. Put your name in the system so that we can reach out. But also, if you do have the time, try to log on and check out the many mass vaccination sites throughout the state, as well as some of the private providers. They're out there and they do have appointments available. They are hit and miss. And so I know it's frustrating at times because you'll go on and you'll see there's no appointments and think, why bother? But tomorrow you could have, 20, 30 appointments open up. And so you really have to keep checking. Unfortunately, the state has not made a one-stop shop module. We've asked them for that. We've asked them for a mass vaccination site here in Montgomery County. Both of those things have been refused at the state level. And so we continue to do our part. Now, just to make sure that we're eliminating a little bit of confusion, the Department of Health and Human Services with Montgomery County Health Department is disseminating its own vaccine. And those are through some of the sites at our high schools, as well as some of our recreation centers like White Oak. The other ones are run by the state. So all of your CVS and Walgreens and Giant, all of those are run by the state. And then the mass vaccination sites are also run by the state. And by run by the state, they get their vaccinations directly from the state. We have no input into how it is that they actually prioritize. We have no input as to how they reach out to folks. We have no input as to how many vaccines they get. We, of course, would prefer to have a lot of those vaccines come to the county. Unfortunately, they're being spread around the county to all these different resources, many of which folks are saying are very hard to get into. So we hear you. We continue to fight for our fair share for the local county health department that will be distributing them with an equitable lens. Yeah. Kathy, you had mentioned before about racial equity and social justice. We have a very strict policy, and that's one of the reasons why we're at the 75 still. Now, I think that we're going to step down and open it up. We've already opened up pre-registration for those 65 and older, and some of the other tier categories for those who have pre-existing conditions. So again, help is on the way. But I just ask for your patience. If you do have questions, please make sure you reach out to 311. They can connect you with a number of volunteers in the community. We have the vaccine hunters that are out there. If you don't have access to a computer or you don't have access to a quality signal and you need someone to help you to set up an appointment, they will do that and help you with that. So there's a myriad of services that are out there.
And that's such a key point. Again, as we were discussing earlier about digital divide, that's a key point for our communities. There is help. Ask for help. Go through the program at which you take your classes, 311 the county. You can get that translated, whatever you need if you're in those categories and need that, because that's the faster we can get everyone vaccinated, the less we spread, the less the disease mutates, and the better off we will all be in the future. So
that's right.
Yeah. So Craig, we're coming up against time. I know you have a busy schedule. Anything else that you want to add? Is there anything that MCAEL can be doing that we haven't mentioned that you see as an ask of MCAEL that we should be thinking about? We play a coordinating role. That what work we do as a coalition. Is there anything that we can do to support your work, council's work, county's work?
I think, again, your main focus is on ensuring that people are prepared for what tomorrow holds. Mm-hmm. And I think that, again, that is incredibly fortuitous for us that we have a great organization like MCAEL who's been doing the work, because we will need to pivot into this COVID recovery. That means getting people prepared for the jobs of tomorrow, making sure that they're ready and raring to go. Working closely with WorkSource Montgomery, who has new leadership and a new vision. Anthony Featherstone.
Yep, I've met with Anthony already.
No,
yep.
he told me
Okay.
and was very excited about it. And so from that perspective, it really is one where those are the kinds of things that we need to have that continue to happen. We need to make sure we continue to prepare our parents for providing support for their students, understanding that as of a week ago, 95,800 of our students in Montgomery County Public Schools will remain virtual.
Right.
That is 60% of our student population that chose to remain virtual. Those parents will continue to need assistance. Those parents will continue to make sure that they understand the lessons that are being sent home, that they understand how to communicate with the teachers if their students are having challenges, and also understand the myriad of support programs that are out there, including our education equity hubs. Stood up, shout out to our Black and Brown Coalition and Community Foundation, who are doing that work. And so it really is something where there's great work that's being done, and MCAEL is plugged in on all of those levels. And so just keep doing the great things that you're doing. We will get through this. My message to those folks that are watching at home, we are going to get through this. We are committed to making sure that we're trying to support you as best as we possibly can. And we know that there is light at the end of the tunnel. The vaccine has certainly helped us to see that. It's still going to take time. So please be patient, but know that we're there with you.
Well, and the weather's warmer, so hopefully we can see each other a little bit more outside where it's safer as we come into spring and summer, and there are different lights there at the end of the tunnel for all of us. So
You're here.
Always want to thank you for your time and your work and your support of MCAEL. And Monica, I guess we'll wrap this up and stop recording and stop going live. Thanks to everyone out there who watches this. Contact either of us with any questions you might have.
Thank you so much. Everybody stay safe. Make sure you continue to wear your masks, even if you've been vaccinated.
Amen. There we go. Thanks, Craig.